Hello everyone, my name is Mariam Karimi, and in this video I'm presenting software-defined ambit of data integrity for healthcare Internet of Things. So, Internet of Things devices are increasingly being used to supplement or replace expensive healthcare monitoring devices. Users should have control over their medical data and be able to refer to healthcare provider of their own choice. For example, in this scenario, we have a patient with multiple wearable devices, maybe heart monitoring devices, smartwatches, insulin pump, and other monitoring devices. And each wearable device is storing the data in the corresponding cloud server that's provided by the vendor of the uh, wearable device. And later on, this patient can visit a doctor, and that doctor can retrieve the data from the cloud server to make a diagnosis about patient's health status. Meanwhile, there might be an adversary that has access to the cloud server and maliciously or even maybe unintentionally change the data and that change in the data may hurt the patient. It depends on the kind of the data. So the patient needs to verify the integrity of data regularly without having to downloading it when the third party is downloading it, or maybe when just sometimes randomly, regularly want to check if the data is still there and is untouched. So we have resource limitation on IoT medical devices. That's why they have to outsource their data onto cloud servers, and it's patient responsibility to verify whether the stored data remain unchanged. The patient verify the data integrity and existence, and the patient or some trusted healthcare provider may be further required accessing this data. However, the level of this verification may be different under different contexts based on the application requirements. We use the notion of context like a contextual integrity. However, previously, integrity was used to examine whether the privacy is violated as context change. However, here we use it to determine the level of the verification that's required based on the context. We said that patient stores the data in the cloud server and the trusted healthcare provider retrieves the data, and the patient needs to verify the integrity of the data. The patient has a gateway. For example, it can be patient's cell phone, and it stores the data in the cloud server and generate and store the keys that are used for like security purposes, encryptions and hashes and other security mechanisms. There is a doctor that has a gateway. The gateway retrieves the data, checks data integrity to owner's gateway, and it shares a small metadata for data verification with the gateway, not all the data, and it's trusted with sending the correct metadata to the patient. However, we can have an adversary over here. It can have like some access to the cloud server that maliciously change the data, or it can be a man in the middle between the cloud server and the doctor, and that starts like to manipulate the communication and manipulate the data that the doctor is receiving. This way, he or she may be able to harm the patient. The patient, based on the patient's requirement and the patient data, the patient context, and many other parameters, multiple methods of data integrity may be required. For example, imagine that I have a wearable device and imagine that I had a heart attack, and this wearable device is measuring the number of steps that I walk every day and also my heart rate. Of course, my heart rate is more important data and should be stored in a more secure way, no matter how much the overhead is. But the number of steps that I walk every day is not that much important, for example. So there, it doesn't need to be like that much secure as my other data needs to be. And the condition that the patient is in, or the like different things affect this level of data integrity that's required. So we adopt the notion of contextual integrity to extract the important parameters, which parameters are like effective in determining what level of data integrity is required. And then we provided a secure architecture by integrating two secure architectures to provide the requirements for multiple level of data verification, and also choosing among them using the contextual integrity. These are the four levels of data integrity verification that we talked about. The first level is Bloom filter. Bloom filters are, imagine that you have an arrays of all zeros, and you grab one block of data, you hash it with k number of hash functions. Each hash functions set a bit in this array, based on the whatever the output of the hash function is, it will be the index in the array, and it will set to 1. Then later on, when we want to see if this block was hashed before into this array, we will hash it again with those k hash functions, and if all the um, outputs are already set to 1, we will know that it was hashed before and it exists in the Bloom filter. We used a 2-layer Bloom filter, since only this small Bloom filter is going to be communicated between the patient and the doctor's gateway, and it will reduce the communication. There is no key sharing requirement. There is no tag required to be added to the data. Only this small Bloom filter that can be stored even on patient side because it's too small, or it can be stored in the cloud server, encrypted and stored in the cloud server. Either way, it's a very a small storage is required. The second method is tree-based check. For the leaves, we used SHA hash function. For upper layers, we use HMAC, which is the keyed hash function. We use unkeyed hash function for the leaves because then the doctor's gateway can just send these leaves and shove these leaves to the patient's gateway, and it reduces the communication a lot without having to share the key among them. And it has very small tags, so a small storage. The third method is PDP, provable data position. It's provided in the literature in the first reference over here. In this method, the owner needs to know that the intact data still exists, and it tags the data using fully additive homomorphic signature. It stores them in a rank-based authentication skip list. And the proof size has a complexity of O log n. It's repeatable. It means that you can check data existence without having the third party retrieving the data, and it requires key sharing, so a little more overhead. Experiments shows that the storage overhead is also a little more than the tree base, and also the more than Bloom filter. The fourth method is POR, proof of data retrievability. In this one, it will add many redundancies to the data. It will add a server code over the data. It will add a dispersal code over the data. And again, it will add dispersal code over the server code to the data. A lot of redundant data is being added to the data. However, if some part of the file or blocks of data or something is lost, or even one whole server is lost, it can still be retrieved and it can be rebuilt. But a lot of storage costs is a lot of overhead. It depends on the method that we require to see if we really require this much security or not, because it costs a lot. It's provided in the second reference. It's called Hey. So this is the comparison between the storage in the cloud, the storage in client side, and communication overhead. The storage in client side is mostly keys, and communication overhead between like Bloom filter, tree, DPDP, and Hail. For communication, we didn't have any data for Hail. It wasn't any in the paper that provided Hail. So as you can see, Bloom filter is the most efficient of all in everything. Then it's tree, then DPDP, and then Hail. But Hail is the most secure one. So we propose, in order to choose among them, we propose contextual data integrity that uses the right mechanisms to verify the integrity of data based on the scope or ambit. And one ambit may require quick verification, but if there is a potential for mischief, there may be mitigated by changing the ambit. Uh, there are a couple of parameters introduced in Nisselbaum's theory that are important for contextual integrity: subject, sender, receiver, information type, and transmission principle. In our scenario, it can be translated to permission, if like the user is providing the permission or not, the merit of the data, the time that's required, the update is required or not, the time that's required for example, retrieving the data. Maybe we need a quick like retrieval. And the affordability of the storage for the user. Maybe a storage is like a little pricey and the user prefer not to store a lot. And the redundancy that we can add to the data, maybe the server do not provide any redundancy, or maybe there is some redundancy in the information type itself that we don't need to add any more redundancy to the data. And then and we have trust and security of both the receiver, it means like the doctor, and the cloud server. Also, sometimes the trust and security of the network will be an important issue. Using these parameters, we built a decision tree. For example, if the user or a patient provided the permission and then the data is very important for us, and update is not required, for example, but it's affordable to pay, so like for some metadata overhead on the server, then the user will choose PDP. So for providing like multiple level of data integrity and providing like contextual integrity selection, we need a framework that utilizes the historical data to build this decision maker, detect a situation or predict one, decide on an action to be enforced, like choosing the integrity of the data. Such application requires architecture that gathers context information and also provide the flexibility to enforce the proper action based on the policy and the context. So we chose actually a software-defined network. Software-defined network separate the control plane from the data plane. For example, here, and switches are only simple forwarding devices that do whatever based on whatever is in their flow table, based on the rules that are installed here. Controller install the rules in the flow table. When host send a packet to the switch, it will check the flow table. If there is a rule exists for that, it will forward it based on the rule. Otherwise, it will send it to the controller and ask for the controller to install the rule. Flow table rules have the format of header, action, and statistics. This architecture provides global view of the network, and it can like get services from different kind of applications. Software-defined network is provide us flexibility and allow us to apply policies and gather information and many other services. However, it has some security issues. For example, controller is a single point of failure. It can have like issues, for example, credential harvesting that will affect authentication and identification, security services, and like many other cyber attacks are proved to be done on SDN, and this affect like a lot of security services. In order to mitigate that, we used STP alongside the SDN. STP separates the security plane from the data plane. In STP, initiating host will send a request to the STP gateway. It will check the policy table. If it exists, it will do the action, same as SDN. However, if it doesn't exist, there are two ways. Either it's an SPA packet, it's a simple packet authentication packet. It means that this host is requesting for authentication or requesting for communication, for a new kind of communication. In which way the SCP is forwarding it to the controller. Otherwise, it will drop it. So the default policy is drop. In this way, it will keep the controller behind the gateway, and it will keep the controller secure, and no unauthorized packet will reach the controller. Using the SCP and SDN architecture, we combine them and build this kind of framework. We have SCP and SDN controller implemented in one controller. Then we have SCP and SDN switches in one switches. If we integrate the flow table with policy table in the controller, and here now we have global information because of the SDN, and we have the security policies because of the SDP. It decides and is aware of security specifications because it has software-defined perimeter. It's responsible for authenticating parties, and it will secure the communications, for example, using TLS. So here, with the combination of SCP and SAN, we could provide a very secure architecture and framework for our method. So our patient, here is the whole protocol, how the patient will send the information and store them in the cloud server, and how here, how store them in the cloud servers, what kind of communication is required, and everything else. We did a feasibility study to see how long it will take to ask for a verification method from the controller, and our experiment shows that it only took 37 milliseconds on average. So it's pretty fast mechanism. And these are the specifications that we have in our experiments. So it's suitable architecture, and it's it has a pretty good performance. We did an efficiency study as well. So we use contextual information acquired from user, SCP and SDN switch, and SCP and SDN controller. We select the matching verification level based on the context. And as for the data set, we used hospitalized patient with heart failure data set. The size of the data set was 1.38 megabit. It includes 2,000 patients information. And the features were that were inside that dataset was admission award, emergency status, occupation. For example, based on the occupation, yes, if the storage is, for example, affordable or not, whether the patient died or not, decides on how important those data can be, discharged or still in care, body temperature, blood pressure, pulse, respiration, history of diseases, such as heart failure, for example. Patients with history of diseases, this is a very important information, and it should be stored with using a POR. If they have diabetes or not, that's also very important. Leukemia or not, tumor, people with who has both diabetes, leukemia, tumor, or combination of multiple diseases, their information is super important because they are in critical condition. If they have liver disease, AIDS, and many other features, it had total of 164 features. In the experiment, 1.2% of the data was selected for being evaluated with POR using that decision tree that was presented in previously. 65% of the data was evaluated using PDP, 4.6% of data is evaluated by hash tree, and 20% of the data is evaluated by Bloom filter. As you can see here, you can see that ADI reduces the required time and storage while still protecting the critical data that need the higher level of security integrity verification. So in this presentation, we had some couple of contributions. First, we provided that data integrity check should be context dependent and scope accordingly. We provided 4 layers, including Bloom filter, encrypted hash tree, provable data position, and proof of data retrievability. Each layer of integrity verification increases security or reliability, but at the cost of higher communication, storage, and time overhead in comparison to the previous layer. Contextual integrity has previously been used to indicate how the notion of privacy may change with context, but here, this is the first time that the layer of data integrity verification has been considered for stored data from IoT in cloud servers. A contextual integrity framework determines the appropriate layer of integrity required based on the context, and like in order to provide that kind of framework, we integrate a software-defined network and software-defined perimeter and provide the whole protocol. So in this paper, we improved the integrity verification performance. We chose the proper verification method based on the context. We provided a method that provides the required security while consume only like enough resources. Based on the contextual parameters of the data and its usage, we used a decision and its usage using a decision tree. It can choose what integrity verification is required. For future, we plan to use signature aggregation to improve the communication complexity in hash tree. We plan to use two-layer Bayesian inference to improve describing the data and creating a dynamic decision maker model. We plan to perform a human subject study to carefully extract important contextual parameters and also a human subject study to investigate privacy issues that may arise with such applications. Thanks everyone for paying attention to this presentation. And if you have any question, you can email me at mak322@pit.edu. Thank you so much.